Hi everyone, Professor Harrell here. I thought I'd make a video about how to survive the nursing program, how to stay in the nursing program. A lot of you have either been accepted into the nursing program, you may already be in the nursing program and are just wondering how you're going to make it through, or you might be in the nursing program doing well, but maybe just this video might be something that helps you continue to do well. So I'll just go over a few things. Number one, once you are accepted into the nursing program, congratulations, you have made a cut. Many students applied and you're one of the selected few that are able to get in and actually begin your nursing education. That is a great accomplishment. Congratulations. Now, how do you stay in? Number one, as soon as you get your acceptance letter, I recommend that you start taking NCLEX questions. Now, this might sound a little silly because you've not even been to your nursing classes. Why would you start doing questions? The reason you're going to start doing questions immediately you get your acceptance letter is that you want to start reformatting your brain to think in the way that nurses think. Your brain is a muscle, and basically when you start doing NCLEX questions and thinking in that manner, your brain is going to reprogram itself and start thinking in the same way. And when you finally get to your first class, you're going to be able to actually eliminate and answer questions in the way that nurses think. So this is going to help you be successful because you want to start getting those A's from jump and not be barely passing. And, come the final, you need so many points for you to progress. Many nursing schools, C's end at 75% or 78%. You don't want to be scoring 78%. That is living too dangerously. Because should something go wrong in your final or in any other subsequent exam, that means you would be dismissed from the program if you fail 2 classes. Number 2, you need to plan, and plan. Nursing school is not about procrastination. So the first thing you need to do is make sure that your finances are in order, your childcare is in order, and your family life is in order. Because nursing school is going to consume you like never before. Your friends, your family, they're not going to see you at those functions, and you're going to live, eat, and breathe the nursing program. It is for a short time, and it is worth it. Because once you cross over to the other side and you become a registered nurse, you're going to be living that fantastic life where you're actually able to impact and do good things for your friends and your family. So it is worth it. You need to sacrifice if this is what you really want to do and just get it done. Number 3, I recommend study groups. I really didn't use them when I was a nursing student, but I do recommend them because I feel like once everybody goes their own separate ways and studies everything that you're supposed to be studying, then you come back, each person selects a topic to teach back. You might be able to catch something that you were not able to catch during the lecture that someone else did. This puts you at an advantage. You also have that edge to discuss and kind of just iron out and maybe even ask the teacher questions that you're not sure about. In your nursing faculty, we are always very excited to answer your questions. So we highly encourage you to come with your questions. We want to hear them so that we can clarify any content that you might not be clear on. So study groups can be good. I strongly recommend that you keep your study group at no more than 4 students because when you get to 5, then you start having the law of diminishing returns where the group is too big and it's no longer effective. Strategy number 5, you need to make sure that you're sleeping enough and you're taking care of yourself. It's important to study, yes, but you also have to pace yourself and make sure that you're not burning yourself out. Because if you're very tired and maybe you're studying through the night before each exam, you're not going to be able to perform very well. So it is very important that while you take time to study, you also take time to take care of yourself. So you're not coming into the exam room fatigued, because what's going to happen is that you're going to know the answer, but when you try and transcribe that answer from your brain to your fingertips, you might start shading the wrong answer, and that can be very detrimental. Now, there's a strategy that I like to talk about when you're doing your select all that apply questions. Number 1 is that you need to understand that select all that apply questions are not that intimidating. So basically, the question asks you what it's asking you, and the choices, if there's 5 or 6 choices, it's basically true and false. So for example, Professor Harrell is a female. And then you get all these answers. Professor Harrell's name is Michelle. Professor Harrell's name is Amondi. Professor Harrell's name is Michael. All those, you're just choosing true or false. So whatever is false, just cross out. Whatever is true, put a check next to it. And once you get the last choice, then shade whatever you have a check on that is correct. And that's it. Stop being overwhelmed when you see select all that apply questions. It is not that serious. You can do it. You just know your content and just cross off what is false, keep what is true. Now, when you're answering your regular multiple choice questions, you want to make sure that you're crossing out what doesn't make sense. Usually there's 2 questions that are correct, but you want to select the best answer out of the 2. And once you get used to that strategy, especially if you're doing your NCLEX questions, you're really going to get comfortable with that. Now, so far as medication, you need to understand what medications are related to each system that you're learning about and be comfortable with them. Usually for the nursing process for medications, you want to really pay attention to what it is that is indicated for that patient. What is the worst thing that can happen with that patient taking that medication? And when the worst thing happens, what is it that you as a registered nurse needs to do? Now, if the medication needs to be given and there's certain things that you have to do, for example, metoprolol, you have to check the epical pulse rate, then you as the nurse need to understand that. So any medication that you're giving, you need to understand what are the implications. If it's phenytoin, you know that you need to check the drug level. If it's lithium, you need to know what the electrolytes are, like the sodium, and you also need to know what the lithium levels are on your patient. And then you also need to know, is your patient compliant or not compliant? And then what organ systems excrete the medications that you're giving. Once you have that holistic understanding, you're going to find the medication questions very simple. The other thing that you need to think about is when you're doing medication math calculations, practice makes perfect. So you've been accepting the nursing program. You know that every semester you're going to have a medication exam. So you need to start practicing your medication exams because there's no shortcuts. Basically, many nursing programs have the pass mark at 95%. So basically that means you can only get 1 question wrong because it's prudent to only kill 1 patient. We hope you kill none, but 1 is the limit that most nursing programs are going to give to you. So you need to make sure that you're very fluent in your calculation for medication math. So finally, you need to get enough sleep, take care of yourself, exercise, schedule 1 day for family time, fun time, and make sure that you develop relationships with your faculty. Come to us, talk to us, ask us whatever questions it is that you may have, and just, enjoy your time. The nursing program is a beautiful time. The relationships that you're making are going to be for life, and you can do this. You made the cut, so I'm very confident that you can do this. I'm proud of you. Hold your head up and keep forging ahead. Don't give up, because at the end, it's really worth it. See you next time at the next video, and thanks for your time. Bye.